This video is part of the skills assessment for ACMGAS301, maintain and monitor animal health and well-being. Today our patient will be Scout, who is a 12-week-old kitten who was surrendered to our clinic. In this scenario, Scout has the zoonotic disease ringworm, which is a fungal infection. Here, Scout and his brother Bandicoot are placed in our isolation area in their cage. So here are our two infected cats. We've got a plexiglass window so that we can look in and observe them without having to touch them, and we've got the signs here. I will give you a close-up of that. And this signage says transferable illness, ringworm, caution, and it just makes sure that all the nurses and the public, anyone walking by, knows that this animal is infectious. I also have the tape here that shows that this little area is sectioned off for mainly isolation, and these 4 cubes are just in our isolation area and aren't used for anything else. Here I am at our consult table in our isolation room. I'm wearing my scrubs, showing off here. I also on the table have disposable gloves and the isolation room stethoscope. And up next I'm showing you I'm wearing my glasses. I've got my hair pinned back. I've also got no nail polish on, no rings, no jewelry. I'm showing you my disposable mask. Putting it on. Here I am demonstrating a foot bath. A foot bath should be used before and after coming into the isolation room, and it should be a solution of disinfectant and water. And here I am putting my shoe in. I'm wiping it on the designated towel. And it gets rid of the majority of germs that I would carry in on my shoes. Ideally, you could also use booties for this. And here I am showing you my hand washing procedure. This clip is very long. Ideally, you want to wash your hands for at least 20 seconds, but I think I did mine for a little bit longer than that. And we get some paper towel and pat it dry. And they're all clean, ready to go. Here I've got my designated red towel, and we're going to be grabbing out the little orange cat, Scout. And I grab him out with the towel, and I want to hold him nice and secure. And we're going to close the cage. Here I've got him. I've got this nifty little timer thing. I thought I would show the camera. And here I am. I have one of the other nurses helping me hold the cat. He was very, very fidgety and wanted to move, but I was eventually able to get a TPR for this cat, and all of this should be recorded on the quarantine record for this patient, which should be put up in their patient records and on the cage card. Here I am with a stethoscope, placing it on the left side of the cat, where its elbows should meet up with its ribs. And I'm going to count the heart rate, count the amount of heartbeats in 15 seconds, and then times that by 4 and add that onto the quarantine record. I forgot to include the clip, but it's also important to do a distance exam before you do a up-close exam. Here I am just petting the cat, making sure he's okay. He did try to escape quite a few times. Good thing I'm wearing my gloves and I had my nurse assist me. And I'm checking his coat quality and mobility. Now we're going to take the cat's temperature, so I've got my isolation room thermometer and our lubricant. And we've got our patient here, and he did not like this one bit, and it took quite a few goes, but you're going to get the thermometer, put a generous amount of lubricant on, and what you're meant to do is lift up the tail, and you're going to insert the thermometer into the cat's anus and press it against the anus wall. But he put up quite a fight, and it took, I think, 15 goes, and then we eventually got a temperature. And here we go, we eventually got it. It was a bit off camera, which was annoying, but we finally got it. And then the thermometer needs to be, here I am cleaning it with an antiseptic swab, and we're giving cats and pats for doing a good job and putting up with that. And next we are giving the treatment. So I'm giving him a little piece of chicken, which we're using as a substitute. He did not want it at all, even though he loves chicken, but we're using it as a substitute for a ringworm treatment tablet. And it was really hard to get him to just take it, but ideally we would hold him up and we would use our fingers to open up his jaw and push it in with our finger, and then close his mouth to make sure that he doesn't spit it out. And here I am bringing him back into his enclosure, and once I have completed his quarantine record, kept it up to date, here I am just popping him back. And once you're done with everything should be cleaned and put away, and here I am putting away the isolation stethoscope with the patient. And I'm going to take off my mask and my gloves at the same time. And then I am going to wash my hands very, very, very well to get rid of any leftover spores that I could have contracted from touching the infected animal. And here I am a little while later, and we're just checking on him and observing. This is Bandicoot, and there he is there. One part I forgot to film was the collection of a sample such as feces, urine, hair, feather, scales. In this scenario, for our ringworm case, a small collection of hair would be sampled from the cat and then stored in a clinical sample jar like the one pictured on the screen. It should be labelled thoroughly and placed into a bag with a clear biohazardous warning sign and immediately transported to the laboratory for testing. Once at the laboratory, the sample is tested for fungal spores. Once you have done this, it should all be recorded and put into the quarantine record. And then finally, you should store or dispose of all the treatment and packaging correctly. Thank you very much for watching. Special thanks to Animal Tracks Veterinary Hospital.